Hi friends, welcome to classes by Lab Doctor. In today's class, let us see about calcium carbonate crystals in the urine. So ये जो कैल्शियम कार्बोनेट के क्रिस्टल्स होते हैं ये लार्ज सर्कुलर क्रिस्टल्स रहते हैं विथ रेडियल स्ट्राइएशन. सो आप देख सकते हो ये लार्ज रहेंगे, सर्कुलर रहेंगे एंड इनके रेडियल स्ट्राइएशंस रहेंगे, बट ये स्मूथ सरफेस में रहता है. स्मॉलर वर्जन्स जो रहेंगे यू कैन सी दैट दे फॉर्म पेयर्स, वो दो दो के साथ ऐसे रहेंगे या तो दे विल फॉर्म टेट्राड्स एंड द क्रिस्टल्स आर स्लाइटली ब्राउनिश इन कलर. So you can see the dumbbell forms also, oval forms also, the tetrad forms also in the background. So इस slide में you can see the various forms of this calcium carbonate. So mainly you can see this one which is larger, which is having large striations here with the smooth surfaces. Then you can see in the background also they have formed pairs and they have formed tetrads and the color is slightly brownish. So these crystals you can see in normal urine also, and there is no clinical, actually there is no much of a clinical significance to this, but why we need to know about this, because we can confuse these crystals with some other elements. And the unique feature, एक special feature is कैल्शियम कार्बोनेट क्रिस्टल का क्या है, that it these crystals will form gas, they will effervescence when hydrochloric acid or acetic acid is added in it. So this will help us to know that these are calcium carbonate crystals in the urine. So ये effervescence जो होता है, जो gas formation जो quality है, ये हमको बहुत ही identify करने में other crystals से help करता है. So I have told you that these are smaller colorless granules, or you can see this small dumbbell shaped also occurring in pairs, tetrads also in the background, and sometimes they form in clumps also, giving resembling a amorphous material. So when you do polarized light and these crystals are birefringent. तो जब bacteria को sometimes you might get confused this with a bacteria, but bacteria are not birefringent, whereas these crystals are birefringent, and we see these crystals in the alkaline medium. Whenever you consume supplements which you take to get more calcium supplements, they are frequently we see these crystals in the urine of such patients. So if such calcium carbonate crystals are present in the urine and your doctor feels that they can lead to stone formation etc., they might add more of a dietary supplement of calcium आपके diet में rather than giving these supplements, because we usually see these crystals in the urine of a patient who is taking calcium supplements. So such crystals, smaller crystals which are there and which are dumbbell shaped and in tetrads etc., little brownish tinge, patient is taking calcium supplements, this correlates with the calcium carbonate crystals. So I have told you that this significance, there is no much of a significance, but then it is seen in patients with decreased urine volume. अगर उनका urine volume बहुत कम हो गया है, urine concentrated हो गया है, the solute concentrate increases and these crystals can be formed. If the patient is having increased calcium levels, or if there is any condition which can lead to increased pH of the urine, like in case of chronic diarrhea हो या certain medicines हो, urinary tract infections हो, so such conditions we can see this kind of a crystal. So I have told you that these crystals, you can see the radial striations here. The smaller ones may not have striation, but they might be round or oval. So we all know that the most common stone in the kidney is a calcium oxalate stone, and this calcium oxalate stone, certain studies have pointed out that the large proportion of this calcium oxalate stone, they have various phases how वो stone form होता है. So in these stones, calcium oxalate is generally associated with minor amounts of other calcium salts. So several reports में ये पता लगाया है कि the presence of calcium carbonate carbonate and calcium phosphate in the renal stone suggests that the crystals of those salts may be present in the early step of this calcium oxalate stone formation. So ये जब studies कर रहे हैं तो पता लगाया है कि the presence of these crystals, कैल्शियम कार्बोनेट हो या कैल्शियम फॉस्फेट हो, जो नो डाउट इट विल नॉट बी द मोस्ट कॉमन स्टोन फॉर्मिंग एलिमेंट, बट ये जो मोस्ट कॉमन स्टोन फॉर्म होता है उसके फॉर्मेशन में दे डू play a role, and they may be present in the initial phases of this stone formation. So such crystals of calcium carbonate etc may promote this calcium oxalate crystallization from the supersaturated urine, providing an appropriate substrate to form such kind of heterogeneous nucleation and stone formation. So these are again the calcium carbonate crystals, and remember that these calcium carbonate renal crystals are sometimes mixed with the phosphate deposits also. They usually, you can see them, I've told you, they occur in spherical forms with radial striations. Sometimes you might, the background you will see they are in tetrads, they are in pairs. They can be seen in amorphous granules, colorless spheres, or like a dumbbells. They are soluble in acetic acid with gas formation. They usually do not have clinical significance. So these are small, colorless with dumbbell or spherical shapes. They may form pairs and they may form clumps. They are distinguished from the other crystals amorphous material by production of carbon dioxide when acetic acid or HCl is added to them. So that is all about calcium carbonate crystals in the urine. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.